All right, we're going to go ahead and get started. So thank you all for joining us on the Iris Telehealth Virtual Career Fair. What I wanted to do first here is start off with some introductions. So my name is Paul Lazarchuk. I am a clinical hiring manager, as is Alexa. But what I wanted to do first is to start with an introduction of Dr. Malaire. So Dr. Malaire is our medical director of outpatient services. She is essentially the clinical lead for all of our ambulatory services. She is double board certified as a child and adolescent psychiatrist as well as an adult psychiatrist. Prior to joining us as an administrator, she has an extensive career providing, face-to-face patient care. The two key functions of Dr. Malaire I wanted to highlight for today's purpose is that Dr. Malaire, she essentially vets and meets with all of our partners, which are the clinics that we work with, to ensure that they align clinically with what we're looking for. So we do have a lot of clinics that would like to partner with us, but we do have a standard expectation of, the ability of the quality of the patient care that we could provide. Dr. Malaire also, she interviews all of the physicians looking to join our Iris Telehealth group. And going on to Alexa and myself, so we are clinical hiring managers to give you an idea of our role in the process. So we actually meet with the clinics to complete a scope of work document. Essentially, this is like an intake document for the clinic. It's very thorough, 2 to 3 pages. We go over to fine details of the positions that we're recruiting for. So you could expect things like hours per week, the patients that you'll be working with, the frontline support that you'll receive at the clinic, things of that nature. We're going to look through our pipeline to see who aligns with those positions. We're going to reach out to candidates that have already been vetted and established. At that point, Alexa and I will present the opportunities. Assuming everything aligns correctly, we are going to coordinate a meet and greet so that you have like a face-to-face encounter with the clinic to have an opportunity to meet them. But Alexa will go over that process in a little bit, a few slides later. Alrighty. And just a little bit of background about Iris Telehealth. So we were founded in 2013 by child psychiatrist Dr. Tariq Shaheen, and we continue to be a physician-led medical group. Along with Dr. Malaire, we have Dr. Tom Milam, who's our chief medical officer. We are based highly in, we really focus on the quality of patient care that we provide. So we're not like an industrial type of system where we just want to focus on numbers. We do want to create an environment that we could provide the highest quality of patient care to the clinics that we work with. So we currently have over 400 service lines with partnerships in 39 states. The average partnership length is 4.25 years, and the partnership NPS score, which is essentially their willingness to continue working with Iris Telehealth and recommend them to someone else, is 84, which is well above the industry standard. We currently have 450 medical providers, which includes psychiatrists, psych nurse practitioners, and LCSWs. And we are also 100% behavioral health service based, so we do not dilute ourselves with medical services, case management. We do this so we don't spread ourselves too thin and we can really focus on our bread and butter. All right, just a quick overview of the 3 types of services that we currently offer. So scheduled services is essentially your standard outpatient or inpatient clinic. So here we're going to match you with your needs, experience, and preferences so that they align with the clinic. Here you're going to have a dedicated schedule, an Iris team, and an on-site support team. I wanted to highlight the Iris team that's going to provide support here. So we are not like other places where we just virtually drop you off at the front door of a clinic and just say good luck, we hope it works out. We are with you every step of the way. You will have a team that works with you and the clinic to ensure that everything is operating smoothly. The next service is a little more therapy based. So this is our bridge care service. So this is created to reduce the issue that we're seeing in our community regarding like the long wait times that we have to get their first appointment. So let's say, for example, we have someone in a community that's suffering from mild depression or mild anxiety. They call their community mental health center. They schedule an appointment and their first availability is 7 to 8 months out. So what IRIS does at this point is we jump in, we might provide med management services, we may provide therapy services to kind of bridge that gap between that and their first appointment before they get established with their primary provider. On-demand services is more based in the ED. So this is for the patients that will come in overnight to the emergency room for some crisis that they may be experiencing. The ED physician may have concerns about their mental health, so they need a psychiatry consult. Unfortunately, a lot of settings, they don't have an overnight psychiatrist. Sometimes they don't have a weekend psychiatrist. So that creates a long wait time and just the poor patient experience where the patient has to pretty much wait for the next day at 8 or 9 a.m. or wait until Monday to be seen. So with our on-demand services, we will beam you into the clinic to be able to the ED to be able to provide a psych consult. And ideally, this is to reduce wait times and improve the overall outcomes for these visits. Alrighty, the 3 provider types that we have at IRIS, that we work with at IRIS, are psychiatrists, various forms of therapists. That includes LCSWs, LMFTs, and LPCs, as well as psychiatric mental health nurse practitioners. And then a quick overview of of the requirements that we have at IRIS Telehealth for these 3 different provider types. So for psychiatric nurse practitioners, we expect them to have completed a master's or doctoral program in a psychiatric mental health nurse practitioner program. They must be board certified through ANCC and have over 2 years of post-board experience. For our therapists, we only have full-time opportunities available at this time, so they must be available for 40 hours per week. We're looking for them to have over 2 years of clinical experience, must live in the United States, and must have passed an ASWB exam or the NCE/NCMHC exam. For our psychiatrists, whether you are an MD or DO, we need you to have completed a 4-year residency program in psychiatry. You must have an active medical license in the United States, and you must live in the US or a US territory. And what I'll do now is I'll pass it to Alexa so that she could talk about the candidate journey with you.
Thanks, Paul. Just before I jump in, I just wanted to let you all know we have a questions tab where you can enter questions, and we'll have a Q&A with Dr. Malaire in a little bit when I wrap up here. So for our candidate journey, first you would submit your resume and your application. That will be reviewed by one of our clinical recruiting coordinators. They will then set you up with a link to schedule your interviews. So you'll do a phone screen and a video interview with one of our clinical talent consultants. They'll review your experience, your preferences, kind of what you're looking for in a new role, really dig into all of those details. And then you'll also do an interview with our medical group leadership. After that, you would complete credentialing paperwork. That includes a background check, just kind of helps our team ensure we can move forward, get you licensed and credentialed as needed. After that, as Paul mentioned, you'll meet with one of our clinical hiring managers. We will discuss opportunities with IRIS that kind of align with those preferences and experiences that you talked about throughout the interview process. We're really looking for a long-term fit, so we want to have a good idea of your preferences, your experience, where you want to go moving forward. Once we kind of determine an opportunity that seems like it's a good fit, we'll do a meet and greet where you'll meet with our partner group, which whether it's a clinic, a health system, hospital, you'll meet with them, get to know their team. After that, you would sign your contract. Our team will get you licensed and credentialed as needed, and then you would start your placement with the partner group. Just some benefits and perks to working with IRIS. We offer health insurance with a bunch of different plan options, dental and vision, again, with multiple options for plans. Life insurance is IRIS covered with the option to purchase additional coverage. IRIS will match a percentage of your salary towards your 401k. You will have up to 4 weeks paid time off and 6 paid holidays per year. And then you also will choose all of your IT equipment. It includes everything you need to be successful working remotely. So laptop, monitor, webcam, speaker, all of that good stuff. We also offer 24/7 IT support for any tech issues that might come up working remotely. All of our providers receive a $1,500 per year budget towards office expenses, as well as $1,500 a year towards CMEs or CEUs. And then we also cover your malpractice insurance. Some other kind of perks and benefits to working with IRIS, our medical staff services team will obtain your licensure and credentialing related to your placement. They do all of that work for you. They will also maintain that licensure throughout your time at IRIS. And then you'll also have a dedicated practice manager who kind of assists you with your day-to-day operations, onboarding, training, overall support. They're kind of like a liaison between you and the clinic that you're working with or the health system. All right, and then just some of our core values. They're kind of the values we live by at IRIS, both on our corporate team as well as all of the clinical work done by our providers. First and foremost is people over all else. Basically, people come first. We have a strong emphasis on the value of relationships, suck less every day, just kind of becoming a better version of ourselves, learning from our mistakes to do better and be better. Execution is queen or king, kind of just taking action to achieve results, pushing through challenges, working hard to achieve our goals. Be quick but don't hurry is mostly about efficiency, kind of working as fast as you can, but really keeping quality of your work at the forefront, keeping a quick pace but not burning yourself out, essentially. And then lastly is love your work, live your work, kind of just having a passion and commitment about your work. It's a reflection of you, and just, yeah, so that's our values. All right, and now we will hop into our Q&A with Dr. Miller, so I'll pass it over to you.
Awesome. And as we're waiting for the questions to come in, and definitely feel free to type any questions in. I can say I started this journey at the beginning. I started researching other career options and found IRIS and applied for a clinical position. And that's how I got to know IRIS and was so impressed with the emphasis on quality was so evident with my first conversation with folks at IRIS, and that's what really impressed me. I had a wonderful match, a wonderful placement that matched with my preferences. People really heard and understood what I wanted to practice. And I had such an exceptional experience and then transitioned into more of an administrative role a little bit before the pandemic started. So I've had the opportunity to get to know IRIS both as a clinician and then sort of a closer view of the inner workings of IRIS as an administrator. And I will say when I started as a clinician, I had no idea what I was getting with IRIS in terms of your supports, having a practice manager that is your person, your go-to for anything that continues the whole time you're employed. There's a whole medical leadership group. There are grand rounds and case conferences if you want to join. There's just so many supports in place that run in parallel with your clinical setting. So I wanted to speak about that because I had just no idea when I first started all of the benefits I was getting when I joined IRIS. So some of the questions, why don't we start? Is there any flexibility in the required experience time for NPs? That is a really good question. I know because there is a ramp in terms of, we don't place people really quickly. We're not like a quick placement company. There's a role for that, but we want to find these long-term connections. So we really take the time to know the candidate and what your preferences are, and then find that fit, hopefully that forever after match, happily ever after match is what they call it. And that can take some time, right? So we know the credentialing, the search, all of it takes some time. So sometimes we'll have a provider say, I have 18 months or I have whatever experience. And I think as long as we're upfront about that timeline, I think clinical hiring is happy to speak to you about that, where you are in the process. I know I've talked to people that's, said I called, I wasn't eligible yet, but here I am. So, we like to keep those relationships going. Alexa and Pal, I don't know what you'd add to that in terms of that 2-year requirement and the flexibility and how that's communicated.
So I know we generally do look for 2 years of experience, but like Dr. Malera was saying, if we find an opportunity that really aligns with what you're looking for and what the clinic needs, we can absolutely have a conversation. Yeah, like I said, it's more of just the guideline that we have. We're more than willing to have the conversation with you. We'll just probably have to have an extra layer of conversations with our leader of our clinical leader for nurse practitioners, who's LaDonna. Yeah, so we should be able to entertain it, but we would just have to add an extra layer of probably another round of interviews is all.
Okay, hopefully that answered that question. If we're not answering your questions fully, please add on to the question. Let's see, there's another question. Are you able to work at Iris and hold another position? And yes, absolutely. When I started at Iris, I started part-time. Iris was really supportive of, you know, my other work. And Iris has a lot of providers that work full-time. We have a lot of providers that work part-time. We're just thrilled that providers are seeing patients wherever they're being seen. We don't have those like really short, like 3 hours a week positions. I think it's generally for prescribers, it's generally about 24 hours and above. I know for LICSWs now it's full-time right now, but we really support other work. There aren't a lot of restrictions. There aren't any restrictions. People sometimes ask about a non-compete. It's very flexible. It basically says you're not going to take the same job from the employer that you're offered through Iris. So it doesn't exclude you from doing telehealth elsewhere if you're working at your local community hospital, something of that nature, or if you have a small private practice you want to continue. We have providers doing all types of different things. And again, clinical hiring can speak to you about that and think about what how it could fit together for you. Let's see, how many clients do LCSWs typically see each week? We do have, I should say, a medical team group leader for LICSWs named Don Napier, who's amazing. And he oversees all the service lines for the clinicians and is a resource. Our service lines, we can expect, or our providers can expect to be working full-time. And everything is very transparent before you start in terms of schedules, number of patients, types of patients, administrative time, when you have breaks, all of it, so that there are no surprises. And this is known to you during the interview process. If an opportunity is discussed, you'll have a lot of those details. So it's hard to say caseload, but generally therapists in a traditional outpatient setting are going to have 60-minute sessions with their clients. There's some variability in some positions if they're intake clinicians specifically. And so caseload really depends on that. We don't have those types of quick follow-up therapy appointments, so that people tend to have a lower caseload because we don't have those quick appointment times. Let's see, are there opportunities to do more than client-facing work for therapists? For example, case management, supervision, community connection. That's such a great question. Currently, I know we're not doing case management. Currently, our therapists are doing intake assessments or providing therapy, longitudinal therapy, or bridge care therapy, which is more of that shorter term work. So we don't have formalized case management yet, or supervision yet. I know some of our clinicians in their settings will attend those case conferences, team meetings, and do offer, teaching and leadership within Iris. People are invited to give case conferences, grand rounds, if that's something that interests you, but we don't have a formal clinician supervisory role currently. Do we supply office equipment? Another great question. So Iris supplies the tech equipment, like the laptop, the speaker, the camera, whatever you need to ensure that you have a good connection to your clinical setting. Beyond that, whatever you need in your office, there's that office expense, that benefit, if you need something. But Iris supplies the tech equipment to make sure that you don't have to worry about your own computer or security on your own computer. That is supplied. Other than that, you can set up your office the way that you feel comfortable. And it's a pretty cool perk that's that annual office benefit. Is this 1099 or W-2? It can be either. I will defer to Alexa and Powell in terms of if there are any restrictions, but I know for prescribers, there is an option for 1099 or W-2, depending on your needs and if you would like the health insurance benefit. But Alexa and Powell, I don't know if you'd add more detail to that.
Yeah, for our therapists, typically it's up to you either way. We've had, I think, 2 positions maybe in the almost 3 years I've been here that had to be 1099 just because of how the schedule worked out. But for the most part, it's up to you.
Awesome.
And on the prescriber side, it's the same thing. We have flexibility with that. The only thing is we require you to work at least 30 hours per week to be eligible for the health benefits. But we could still have you working as a W-2 employee with less than that. It's just you don't have those benefits.
And then there's a question, are LCSWs paid hourly or salaried? And my understanding of all the reimbursement, it's something that, again, people are really transparent about the hourly rate, so that we're not like a traditional like fee for service model. Like you can count on consistent pay and consistent hours because we really vet our opportunities, and we want to make sure there's enough patient flow to ensure that people have the patients that they need to see to support their schedule, whether it be full-time or part-time. We know in the best and organized settings, we will have no-shows, and that's okay. That is time if you need to document, if you need a minute to have a break. When those no-shows happen, if there's not another patient, then that's going to happen. You're not docked pay, so to speak. So that I know a lot of people like that they know they can count on that consistent pay, because I know other models can be a little bit difficult to predict. Let's see, how many clients a week are therapists to see to meet expectations? Is there a metric? That's such a great question. We love metrics here. We love to look at data. And that's something that, our quality department has been continuing to look at. We want to help our partners, get their patients seen. There's not sort of a requirement in terms of, X number of clients must be seen. And we get ahead of that by vetting our clinical settings before we partner with them to understand the patient flow. We really want to make sure that the organization can support a certain number of hours, so that our clinician has a nice long-term employment there and can build up their caseload and have consistent patients, consistent work. So there's not like a minimum. I think it's just, we iron out the hours that a clinician is expected to work, and that the clinic fills up their schedule accordingly. How is Iris funded? Through client paying grants or a mix? So we are a private company. So the way it's structured, and I know it took me a while to figure it out when I was interviewing, our providers are employees of Iris. So we have a contract with our employees. You get paid through Iris. So on X day, you're getting paid for X hours consistently. Iris has a contract with the clinical setting, and that is ironed out, again, well before someone's placed there, so that we are reimbursed for the provider's time. And so that's variable depending on how the clinics are funded. If they're, some CCBHCs might have grants on their community mental health centers that are billing Medicare and Medicaid, third-party payers, so that how they get reimbursed can vary depending what type of location, where they're located in the country. But again, we look at clinics' finances as well before partnering with them, because we look for a very stable and long-term relationship. How long is the hiring process? Good question. I will defer to Powell and Alexa for more of this time frame.
Sure. So the hiring process, it varies. It really just depends on your availability. We do like to do a thorough vetting process ahead of presenting you with opportunities. So that way, once it's time for us to discuss one of these clinics with you, you're pretty much ready to go. So to give you an idea of really of what we expect up front is we would do a initial video interview. We would have you complete a letter of intent, do a background check. If you're a physician, we would probably have you schedule an interview with Dr. Malaire as well. It's difficult to say the process to get this up and running. I would say typically 1 to 2 weeks, I would say is pretty reasonable. It just really depends on availability. And then after that, we'll start presenting you with opportunities. Let's just say we present one to you and you are interested in it. We typically meet with you shortly after to complete a service summary agreement, which is the outline of the expectations that we're going to hold both the provider and the clinic accountable to. Once that's completed, we'll schedule that meet and greet. Again, at this point, we're looking at another week or so. We ask both sides following the meet and greet to make a decision within 48 business hours. So best case scenario, I'm thinking 2 to 3 weeks, sometimes up to maybe like 3 weeks. But like I said, we are really focused on quality matches. We're not just trying to throw you somewhere where you kind of fit. So we want to make sure that you very much align with what the clinic is looking for. So yeah, it's difficult to say, but I would say it's a few weeks typically to get you up and running and have the contract established so we could start credentialing and licensing you.
And then I'll add to the placement process, as Powell was saying, there's licensing and credentialing. We have an amazing department here that helps out with that, and they're experts in the field. But we know that providers often need to give, sufficient notice, and we're aware of that and work with providers with when they need to leave notice, so that people have time to do what they need to make sure that if they're leaving a position, that their patients have good aftercare. One other question, does IRIS provide services to the child and adolescent population? Absolutely, we do have child and adolescent opportunities. When I started, I worked at an adolescent residential center, for example. We do have outpatient settings as well, where there are child and adolescent needs. And some of our positions, they're looking for folks that will see child and adults. If people are comfortable with that, there is opportunity for the lifespan, because I know some folks really like having that variety as an option. How flexible, this is a good question, is scheduling of patients? How long in advance do we need to notify to take PTO? So the schedule is kind of predetermined before you start. So as I said, you start at a certain hour and you finish at a certain hour, when your breaks are, when the administrative time is. And then the clinical setting, again, this is more of a traditional outpatient setting. They'll schedule you. So they'll say, Dr. Malaire is here from 9 to whatever, 5, and we're going to book her, 2 intakes in the morning that are both an hour, and then follow-ups, not on admin time, not on her lunch break, so that, I know when I need to be there, when I'm done. We really focus on when we're partnering appointment times as well, so that we know we want our providers to have time to document and e-prescribe and be done by the end of the day, not have an ever increasing workday. I know we all go above and beyond to do what we need to do, but we don't want to burn out our providers. So we, really want to count on that schedule, the begin time and the end time. And so the flexibility in scheduling of patients it's kind of a template generally for a traditional outpatient position, where you kind of know when patients are going to be scheduled in advance. And again, that's something you can talk about with the clinic and clinical hiring regarding your schedule needs. And then how long in advance about PTO? I mean, definitely our clinics like to know as far in advance as possible because they want to make sure that your schedule is blocked off and there aren't patients. We know emergencies happen, people get sick or need time off, and that you can either communicate directly to the clinics, or at Iris you have your supports that you can reach out to as well to help with communication. So I know our clinics really, expect our providers to take their vacation time, and they just will have conversations with you at the beginning about who to notify, when to notify, so that your schedule is blocked and all that good stuff in plenty of time. Let's see. I read there's flexibility, such being able to walk your dog. I have a dog, so I'm laughing. That being said, what might a typical remote day look like? So yeah, it depends on the clinical setting, what a typical day. It really, many ways, it should emulate if you were there in person in terms of your supports, your communication pathways, your feeling a part of the team. So the difference is, instead of, going to the lunchroom for a coffee break, you can go to your kitchen, or you can walk your dog, or, if you have a no-show, or, you're waiting and have an extra 15, 20 minutes, half an hour, you can walk your dog or do what you need to do. I mean, the expectation is that you have patience all day, but you have your break time. Obviously, everyone needs to have a minute to get up, to stretch, to do those things. And the difference is you're at home, not in an office or hospital setting. So that is the flexibility there. I don't want to imply that there's flexibility in terms of the day-to-day. I think that's pretty laid out in advance in terms of your schedule and expectations. But as there are breaks in the day, as you have maybe a no-show here or there, then you have time to do what you need to do. And if I'm not answering that question, please follow up. So do we have opportunities for folks that want to become a licensed social worker? I know we started with LICSWs, and I know we've opened it up to some other licensed therapists. And I don't know, Pal or Alexa, if you wanted to address that one in terms of that pathway for clinicians.
Yeah, I can jump in. So as of now, all of our therapists have to be independently licensed. So if you're kind of in that in-between time where you're working on obtaining that licensure, unfortunately, we don't have any opportunities there. But once you are fully clinically licensed independently, then we can kind of start working with you and looking at the opportunities we have available.
Awesome.
All right, I think that wraps up our questions. So this slide just talks about our behavioral health messenger. If you are wanting to stay up to date with kind of all things Iris, you can sign up for our monthly newsletter. It covers behavioral health related news, job opportunities, CME or CEU resources, insights and interviews with current Iris providers. So you can subscribe, you'll get a link after this, and you can subscribe there. And then Paul and I are gonna just touch on some of our current opportunities. Typically, they don't stick around for too long, but this is kind of just a good representation of the work we do. And if you're interested in these opportunities and they aren't available by the time you move through our process, we will likely have something pretty similar. So Paul, do you want to jump in and cover yours first?
Yeah, absolutely. Yeah, so for the psychiatry side, we currently have an opening in Pennsylvania for 32 hours per week. The ages is primarily 18 and up. If you're able to see all ages, that's a plus, but not required. The diagnoses that you're working with here are kind of what you would expect from a community mental health setting. Moderate to high acuity, which includes severe mental illness, substance abuse, bipolar, depression, trauma, and dual diagnosis. We do have another one in Illinois looking for 40 hours per week. The patient ages are all ages, so I believe that's 5 and up. The diagnoses here is generally just moderate acuity, standard outpatient acuity. For psychiatric nurse practitioners, we did just have one come up in Texas for 40 hours per week. Ages are all 18 and up, so no children and adolescents. And generally, we're looking for, like I said, the community mental health diagnoses, so higher acuity, severe mental illness. And again, it's not to say that these are the only 3 we currently have. We have several that we're working with, but these are just the hot ones that we're recruiting for actively, and in case anyone was interested in those. So I will pass it to Alexa for the therapy side.
Yeah, so we have one right now in California. Typically, a lot of our therapy positions can be any licensure type, LCSW, LMFT, LPC. This one is LCSW only. They are looking for 32 hours a week. I know we mentioned our therapy options are typically 40 hours. This is like the one outlier that is looking for 32 hours a week. It is working with all ages. Typically for therapy positions, when we're saying all ages, it's like somewhere between 6 and 8 and then up to 100. The diagnoses for this position are pretty standard community mental health diagnoses: depression, anxiety, bipolar disorder, substance use, trauma, and then a small percentage of SMI as well. This position is looking for somebody who is bilingual in Spanish and is able to provide therapy services in Spanish. The other position mentioned on here is in Wisconsin and Michigan. If you have either of those licenses, that's a huge plus, but again, not required. We have our team that'll get you licensed. These positions are for 40 hours a week. They are all ages as well, and pretty much all diagnoses. So that one's pretty broad, but we're looking for somebody for those as well. Yeah, if you are interested in applying in any of those positions or just hearing about some of the other positions we have as well, please send an email to talent@iristelehealth.com. You can put career fair interest in the subject line and attach your resume, and we'll be in touch. Thank you so much for your time today.